Hello and welcome to Cardiology 101. This is Dr. Shiraz, and today we are going to learn about another conductional delay, that is right bundle branch block. So as we discussed in the previous lecture, that was of left bundle branch block, that the conductional delays, for example left bundle branch block or right bundle branch block, are commonly accompanying some heart pathologies, and we should look for that, and they also make the prognosis for that heart pathology worse. With respect to right bundle branch block or left bundle branch block, it is important to note that they are accompanying myocardial infarctions. So it is very important to point out these bundle branch blocks on ECG and look for the pathological cause of that bundle branch block. All right. So again, we will discuss what is right bundle branch block. You know, this is AV node, and then this is our bundle of Hayes. This then divides into left bundle branch and right bundle branch. This one is our right bundle branch. So for example, if there is pathology in the conductional system or the heart or the myocardium, for example, there is right ventricular hypertrophy or other cardiomyopathies, we will see that this right bundle branch block gets blocked. Conduction below this part is impaired. As the conduction is impaired, so will be the activity of myocardium below it. So that's the significance of right bundle branch block. What are the ECG findings of right bundle branch block? Again, we will have broad QRS complexes, any QRS complex that is wider than 120 milliseconds or 3 small blocks. RSR pattern in V1 to V3. What is RSR pattern? We will see a small R wave, then a large S wave, then again an R wave. Okay, let me try it here. We will have R wave, then goes S, then we will have R wave again. So this is our RSR pattern. So if I ask you to look at this way, this look like a M pattern, right? R, then S, then R again. So in the lateral leads, what are our lateral leads? V5, V6, and high lateral leads 1 and AVL. We will see slurred S wave. This is opposite of left bundle branch block, in which we saw that the slurred S wave was in V1 to V3. And our slurred R wave were in the lateral leads. So this is in opposition with left bundle branch block. Then again, discordant ST or T changes. So if you haven't watched my previous video that was of left bundle branch block, you should definitely watch that, and you will learn very important concepts over there. I will post the link in the description, and you should definitely watch that. And I will discuss what is discordant ST or T changes in the examples of ECG that we are going to discuss next. So as I told you in the left bundle branch block video, that we can remember left bundle branch with the mnemonic Willem. Alright, in the right bundle branch block, we can remember it with the term Marrow, MARROW. Marrow has double R in it, so right bundle branch block. Alright, what does Marrow means? M for M. We will see that in our right precordial leads that are V1 to V3, we will see a M pattern or RSR pattern. You will see that this is our R. Initially we see a R wave, then an S wave, then again a large R wave. All right, this is also called right rabbit ear appearance. All right, so this is our M appearance or RSR pattern or right rabbit ear appearance. But in the lateral leads, in the V5, V6, we will see a slurred S wave. All right, if you look at here, this is not notched, this is somewhat slurred. All right, so this is our W pattern. So with Marrow we mean this pattern. All right, our an important point to note here is that our axis can be normal. All right, it can be deviated, but most of the times it is normal in the right bundle branch block. So in V1 right now we can see it starts with small R wave, then S wave, then again a large R wave. All right, this is our M pattern. All right, this is our M pattern. And in the case of V6, we see that this is making our W pattern. First we have a Q wave, then it is R wave, and then S wave. All right, so this is our W pattern. Same pattern is repeated over here in the 1 and AVL. Slurred S waves are seen in the AVL and in lead 1. And our QRS complex is broad. If we look from here, from the start of R wave to the end of S wave, it is more than 3 small blocks. So these are broad QRS complexes. All right. So now let's talk about the discordant ST-T changes. In the left bundle branch block, we discussed that both ST segment and T wave would show disconcordance, but in the case of right bundle branch block, we will see only the T wave showing disconcordance. For example, this is our positive QRS complex in V1, alright. This is our positive QRS complex in V1, but our T wave is inverted. Similarly, our QRS complexes are positive, but our T wave is inverted. Alright, so this is our disconcordant T changes. Another example, if you look at V1, you will see that this again is showing M pattern with small R wave, then S wave, then a large R wave, and our T wave is inverted, that is disconcordant change. And again, QRS complex is broader than 3 small blocks. And in W, we can see a slurred S wave. This is slurred S wave. Similarly, slurred S wave over here and over here. Axis again is normal. So this is our right bundle branch block. One more example. In this ECG, if we look at V1, what pattern are we seeing in here? This pattern is consistent with slurred R wave. Slurred R wave is somewhat similar to M. So for example, if I draw a R wave and I make small slurring here, it doesn't look like M. This is a pattern you should be very familiar with. So alright, then again disconcordant T changes. Our QRS complexes are broader than 3 small blocks. In V5 and V6 we see slurring of S wave in lead 1, in lead ABL slurring of S wave, and our axis is normal. Again, a point to note here is that when I discussed that these bundle branch blocks are sometimes coming with myocardial infarction. So if you look at inferior leads, lead 2, lead 3 and lead AVF, you will see that these are hyperacute T waves, which we discussed that hyperacute T waves are part of STEMI. So this is inferior wall MI coming with our right bundle branch block. So I want you to remember this on your fingertips and never forget the concept of left bundle branch block and right bundle branch block. So that was it from today's lecture. I hope it cleared your concept of right bundle branch block. If you have any question, comment down below and I will be happy to respond to them. Thank you.